So a multidisciplinary approach is clearly required when we decide on the treatment of patients with hepatocellular carcinoma. Because in general, patients with hepatocellular carcinoma have two diseases. They have underlying liver diseases with liver fibrosis, and they have the tumor. And when we decide which treatment is best for the treatment, we have to take both into account. So how good is the liver function, which treatment can the patient tolerate, and then of course we also have to look at the tumor burden itself. What kind of tumor is it, how many tumor nodules, how big are they, and then we can decide what is the best treatment for this specific patient. And to do that, we clearly need a multidisciplinary tumor board. So we need the surgeons, the hepatologists, the oncologists, the pathologists, radiologists. It all are part of the team, and together we can decide what is the best treatment. So when we look at the multidisciplinary tumor board, there are colleagues from different departments. So first of all, we need to make the diagnosis. In HCC, we can make the diagnosis just based on imaging. So for that, we need the radiologist. But on the other hand, of course, we have a lot of targeted therapies and clinical trials. And sometimes we also need molecular diagnosis. So the pathologist should be clearly part of the team. So these are the two colleagues we need for the diagnosis and to see tumor burden. Then we have the hepatologist. The hepatologist will tell us about the liver disease and the liver function, which is quite important. In terms of systemic therapy, it's usually a mixture. It could be the oncologist and or the gastroenterologist or hepatologist who will provide the treatment depending on in which country you are in. And then for the local therapies, we would require interventional radiologist. In some countries, it could be also the interventional gastroenterologist. Yeah. Of course, we need surgeons. The surgeon can decide on liver transplantation, and if liver transplantation is not an option, to which extent partial hepatectomies, for example, are possible for this for a patient. In HCC, it's so crucial and really important to make the diagnosis within a multidisciplinary tumor board. And this is not only the case when you start treatment, but at each time point when you do the CT scans as follow-up scans and see how did the treatment work, and to decide how to proceed, you really need the tumor board. So if you do not have the opportunity to discuss really your patient along the way of treatment within a tumor board, I would really think you should not treat the patient. It's really different from other tumors, and in my eyes it's because of the underlying liver disease a little bit more complicated, and the hepatologist and gastroenterologist really needs to be part of the team. So patients with HCC clearly should be treated in larger centers with experience in HCC. Communication within the interdisciplinary tumor board is extremely important because we have all these different members of the different department, and of course everybody is trying to provide his treatment and is convinced that his treatment is the best treatment. Yeah? But still, in most patients, only one or two treatments are really appropriate and the best choice for the patient. In the last year, I think we have really been used to communicate a lot, and we have learned a lot, and I think we understand the possibilities each treatment can provide for a patient, and we are getting better to see to really see the specific opportunities where we can use one or the other treatment. And so at the moment, I think it's not really that difficult anymore to come up with the right decision, because I mean it's really so dependent on tumor burden and liver function that in most cases we can really easily come to a decision.